So firstly, I would like to introduce our first speaker, who's Tony McCusker, who's acting on the behalf of Jim Ryan, who unfortunately cannot be with us today. You know, Jim is quite a busy man. So Tony is our General Manager in the National HSE Mental Health Community and Operations Office. And he's also a registered mental health social worker. And he's a senior social worker in the mental health services in the Southeastern Health and Social Care Trust in Northern Ireland. And he has also spent 6 years as a principal social worker with the HSE Adults Safeguarding Service before returning to mental health in his current role. So I'd love to welcome Tony.
Hi, I'm Tony. I'm about as far away from Mr. Ireland as you can get. But yeah, just to say, on behalf of myself and the whole National Community Operations Mental Health team, including Jim, who unfortunately can't be here, we'd like to welcome you and hope that you have a great time today. It's great to see so many people. It's great to see so many people face to face. I heard someone saying, I'm so used to seeing this, and I certainly don't miss a little picture of me looking back when I'm talking. The last time there was an opportunity like this, I think, was Wexford in 2019. And obviously the world has changed quite a bit since 2019. The one thing that hasn't changed, though, is the need to continue to develop mental health service provision in a collaborative, user-focused way by focusing on engagement and recovery. And hopefully we'll all have an opportunity over the course of the day to push that on a little. In order to prepare for this public speaking, which I hate, I did a reflection on what engagement means. And as with everything, engagement can mean different things to different people. If you look it up in the dictionary, you get a number of meanings. And I did that, so I'll let you decide how relevant you think those meanings are to your understanding of engagement and the purpose here today. So the first one is a promise or a pledge. The second is a promise of marriage or betrothal. So if anybody does think that's very relevant, you now have the space to come up and use that. Anyone? Okay, move on. An arrangement to go somewhere, to do something, to meet someone. Employment or a period of employment, especially in the performing arts. A conflict or a battle. Financial obligations or commitments, or a state of being in gear. So that's what the dictionary says about engagement, but we're lucky, as Pam has outlined, we know what we're talking about when we say engagement here. Good practice engagement involves the interplay between 4 elements: capacity building, listening, relationship development, and decision making. And that resonates with me as a social worker. And as Pamela said, I was a social worker in Northern Ireland, mental health social worker in Northern Ireland. And just thinking back on one instance where engagement made a huge change in the pathway for someone's care. And this is actually one of the very, very few times I've had an official compliment, so I'm quite happy to share this story. But this was about a gentleman whose wife had become very concerned about him. And because he loved his wife, he engaged to come to our mental health assessment centre to be one of the 9 people that day to be initially assessed by mental health. 9 people in 7 hours lets you know how short a time that meant he was going to be given. And he was seen by a nurse and a social worker and then a doctor. And what he got was the same questions over and over again from those who were asking them. And what he felt was too much personal questions in such a short space of time. So actually he got up and he left the assessment. I can't cope with this, I'm leaving. So I visited him later on that day because his wife had been so concerned, and actually the doctor was so concerned. And they keep it anonymous, but his presentation was he had been on holiday, and unfortunately he'd holidayed a little too hard, and became a little paranoid. He thought that he was under surveillance when he got home. Now, his history, he had a military history that his wife didn't know about, and he didn't want his wife to know about. But when we sat down, he was initially very angry with me, because I was part of the services, saying, you're not there to help me, you're just questioning me, you're part of the system. So I started by saying, well, what is it that you want? And I wrote it down, because he started with a list of things that he didn't want, first of all. I don't want medication. I don't want to hurt anyone. I don't want my wife to know. When we moved on, they said, what do you want then? Well, I want to understand what's happening to me. I want it to stop, and I want to make sure it doesn't happen again. So that allowed us to open a dialogue and build a relationship. I'd probably visit him twice a week for a couple of weeks. As he had highlighted himself, he says, I don't want to hurt anyone, but I'm skilled. I could hurt someone. I could hurt someone very badly just because of my history, and that fills me full of fear. And I don't like talking about that part of my life because I met my wife afterwards, and I don't want her to know that part of me. So over the coming weeks, we talked a bit about what had happened to him and what sort of things had led to the type of thoughts he was having, and how common it is that people can experience phenomena like that. So we built a relationship, and maybe after about 2-3 weeks, he said, I kind of want my wife to be involved in this. Now that I know what's going on, and now that I feel I can trust you, I'd like my wife to be involved in these sessions. So she started joining us and became part of the recovery plan. And it led on to things that looking at what he believed his triggers would be and how he would like his treatment plan to look. So when we finished up, the one thing I always remember saying, he still didn't want any medication. He didn't believe that's what he wanted. But he was happier to engage with the doctors. He now could see that they were coming from a place, didn't have the type of conversation I had with him, but were coming from a place of trying to get him into a recovery space. So that highlighted to me, and as I said, about a year later, I got a little card, a little official, he'd written into the organisation to thank me. And it made me reflect on just, well, what did I do that was different than any other time? And I don't think I did anything different from any other time, but I realised how important that was to him and on his journey, because I was often the social worker in the assessment centre who was seeing 9 people a day. And quite often it was the same questions. We would ask them. If we felt the person needed to see a doctor, they'd go to the doctor would ask the exact same questions over again. So it just made me reflect on how important it is in the service user journey, and what engagement actually means, and bringing someone into the control, because he liked to have control of his own life, into control of his own plan. So that's why it's important to me, but I know that each of you will have stories like this, and it's experiences like this that we need to continue to build on and learn from. Community operations in mental health continue to strive in being innovative in how we engage with service users and their supporters, and how mental health services can be accountable to the people who use our services. So we're proud to have a national project dedicated to just that, the Enhancing Engagement Project, and we're delighted that Genio has decided to support us in that pursuit, and I know that Michael and others will be talking about that later on. As you know, health provision in Ireland is currently going through a massive programme of change, and our commitment to engagement and recovery fits with this. The principles underpinning Sláintecare, which advocates for right care, right place, right time, are very much reflected in the engagement process and structure. Public and political engagement and empowerment is a named programme in Sláintecare's implementation plan. You'll probably also know that user engagement is a cross-cutting theme in the Sharing the Vision recommendations for bettering our service provision, and Michael Ryan is leading on the Mental Health and Engagement Recovery workstream under Sharing the Vision. Underpinned by the principle of partnership, the Sharing the Vision implementation plan has a strong emphasis on meaningful inclusion of service users, families, carers and supporters in service design. Its delivery will be driven by an outcomes-focused and shared commitment to work in partnership with staff, service users and families, and all relevant stakeholders to achieve our goal of a modern and fit-for-purpose mental health service that meets the needs of those who require our service. And I think today will give us a great opportunity to shape any future services with service users and their supporters central to any development. I hope you have a great conference. I hope you really engage. And I can see that people are, I know that there's a few more to join us, but it's great to see so many people involved. But thank you, and again, welcome.